On this podcast, you'll find interviews with high-performing, successful individuals in life sciences. On a weekly basis, we cover their proven methods, principles, strategies, and mindsets to implement new technologies that scale to meet the needs of people in our world.
Welcome to the Life Science Success Podcast. For those of you who don't know me, my name is Don, and I'm a consultant in life sciences. I help companies manage complexity and increase performance. Today, I'm joined by Stephanie Wisner. Stephanie is the co-founder of Centivax, and we're also going to discuss her new book, Building Backwards to Biotech, The Power of Entrepreneurship to Drive Cutting-Edge Science to Market. Welcome, Stephanie.
Thanks so much for having me. It's great to be here.
Yeah, thanks. So can you tell the listeners just a little bit about yourself?
Sure. So I did my bachelor's degree in chemistry and chemical biology from Cornell University. And then I, fell in love with basic science there and really wanted to see some of the exciting things I was working on get translated out of the lab where it could reach real people. And I always had this question in my mind about how you were able to do that. And so I kind of thought that the route that I would take was to go to medical school. So, like a good pre-med student, I did all the pre-med curriculum and I did research after I graduated. I also became a medical scribe in internal medicine. And so I was the person shadowing a doctor through all the appointments where we talked to patients. And what I saw very quickly, it was just this need for new medicines because so many of the patients we were seeing had conditions for which there were no good treatment options. And then on the other hand, I was still working in the lab and I was seeing again that there were these really exciting novel scientific ideas, but without a path to real world application. And so around that time, I got a totally random email from my alma mater that had a subject line, something like entrepreneurship training for scientists, learn how to turn your research into something practical. And I had never thought about entrepreneurship before. Like the science major I was, I had only ever taken a variety of science classes and had stayed far away from things like economics and accounting and business classes. So this was a total pivot for me, but I was very intrigued. So I ended up taking the class. I had the opportunity to learn from really experienced biotech entrepreneurs who taught in the Cornell Business School. And they mentored me and were kind of like, hey, you know what? Have you considered an MBA? I think that might make sense for you. And so I said, no, I haven't ever considered that actually, but I went ahead and applied and ended up coming to University of Chicago, where I finished my MBA. While there, I had the opportunity to also start a biotech consulting business and work on this book. And I also worked at Arch Venture Partners as an analyst for a couple of years. So throughout all of that, I got to learn a lot, work with a lot of companies, but I also really saw a problem, which is that in the scientists I was working with, a lot of them were really excited about biotech entrepreneurship, but didn't know where to start and they didn't really understand the ecosystem. And while there were books about drug development and there were books about startups, there weren't books about both of them together. So I ultimately decided to write the book that I wanted for myself in the hopes that it would enable more scientists to get into what I see as a very exciting industry, because I believe that the medicines of the future are going to be created by scientists, but those scientists can't get into the industry unless they're empowered with the business skills and knowledge that they need to succeed.
Yeah, it's funny that the premise of your book is something that I'm working on as well, kind of in the background, is just a little bit of training for people as well around, how do you scale an organization? Because that's another problem that, entrepreneurs
Absolutely.
oftentimes run into as their businesses start to take off. But so just to back up just a little bit with regards to your background, though. So you also worked at Centivax. Jacob Glanville's been on the podcast as well. And so,
Yes.
can you talk a little bit about how you met Jake, and how did you wind up at Centivax? How did that whole thing get started?
Sure, that's a great question. And, I think this is a great opportunity to give kudos to Jake and credit to Jake because he is, an incredible entrepreneur and leader. And I'm very lucky to work with him. And he's also someone, a lot of people talk about, being pro woman or pro giving people chances, and Jake is probably one of the best people I know at actually living that out. So I just want to give him some credit there. But the way I connected with Jake initially was actually because I heard him speak on a podcast in 2017. I was still working in the lab, so I, was pipetting away and listening to a podcast that day, and it happened to be Startup Podcast by Gimlet Media, and they interviewed this guy named Jake Linville. Started a company called Distributed Bio. I thought it was a really exciting story. This was probably my first introduction to biotech ever. So it came right before the iCore class, which I took at Cornell. And so I think I looked up Jake on LinkedIn. We ended up becoming LinkedIn connections, and I just kind of kept an eye on him over the years. And when I started my consulting business, I wanted to see if there was a way that we could work together. And so I ended up working with Jake as kind of a business consultant to help him with the acquisition and spin out process of his first company and starting Centivax. And then he very kindly at some point said, "Hey, you've done a lot. We need someone to work on the business side of Centivax. Do you want to come in as a co-founder?" And fortunately for me, I'd had multiple years of experience at this point of working with, arch companies, of working with my own clients. And I was looking for somewhere to just land and to invest deeply in building. And so, of course, I said yes.
Perfect. Yeah. So, I mean, just a great story of how things can kind of align. Oftentimes I'll say that the life sciences industry or healthcare just in general, so many of us wind up in our own niche. And then, with that, we kind of wind up naturally working together with people over and over again anyway.
Yeah,
And
absolutely.
so yeah, I mean, just a great sort of testament to Jake and in the fact that you wound up in the right spot, obviously.
Yes, for sure.
So let's talk a little bit about your book. So building backwards to biotech. I made this mistake earlier because as I was building out sort of the titles for the podcast and things like that, I keep switching those words. I keep switching biotech and backwards. But so what is the premise overall of the book? I mean, you said that it was, kind of built from this idea that, this is a sort of book that you would have loved to have had. What is the premise of the book and why would somebody pick it up?
That's a great question. So what it is it serves as kind of an overview of how the biotech industry works. There's hundreds of interviews in there from really experienced entrepreneurs and scientists. But the premise of the book and where the title comes from is this concept that I saw over and over again, which is this transition that scientists kind of have to make mentally if they want to succeed in the business world. And that's in academia. By nature, academia is a very exploratory area. And so, by nature, in academic science, a lot of times people aren't necessarily thinking from an end goal. And, there might be an end goal like getting a PhD, writing a thesis, publishing a paper, but it's not an end goal in the same way as getting a concrete data set to get a drug into clinical trials or to get to market is. And what I realized from talking to people like Jake is that successful entrepreneurs were able to make this mental pivot once they got into biotech. They had to build backwards from a set of goals, whether that goal was clinical trials or drug approval or even just de-risking an experiment, and be able to make that pivot in thinking. And I was able to kind of see that theme in all of the interviews, and so I was centered the book around that idea.
Yeah. And I mean, so many times that I hear the kind of the first rounds of presentations from entrepreneurs, they're so linked in the science or so linked in terms of the technology that they're going to offer. They expect everybody else to kind of get or understand that concept. And oftentimes
Absolutely.
it takes making that leap of how does this treat patients or how is this going to impact the world? That really, starts to then build the transformational presentation that will be one that investors want to invest in versus, hey, you have the, some neat new technology or something that is, fantastic scientifically, but it's harder, I think, for investors to sort of grab onto as well.
Absolutely. And also, just to take it down to a concept in one of the chapters, which is around financing, people don't always realize that when you're building a biotech company, you actually have to build towards value inflection points with each raise, because you want to make sure that you're increasing the value of the company every time you raise money, or your investors will not be happy because they're losing money and or losing their return rather. But in order to make that happen, you have to actually plan backwards or build backwards in order to think about which experiments you're going to hit at which times with which inflection points and when you're going to need to raise. And that all kind of starts from walking backwards from what it's going to take to get your drug to market, even if you aren't necessarily going to be the one to take it all the way. Having an understanding of that and having a backwards built plan of how you're going to get there is really necessary in order to succeed. Where I've seen a lot of entrepreneurs or heard stories of failure is a lot of times when people fail to make that shift away from kind of the academic model of thinking, which is more of an exploratory mindset where you find a pathway, you want to investigate every detail of it. That's not bad, but you also have to have this concept where you know that you are continuing to build value in the company and you are actually progressing the company and building increasingly more value for your investors.
And so I'm going to pull out just a couple of excerpts from the book. So I did read the book for anybody that's
Oh, thank
listening.
you.
And one of the things that I sort of extracted from it was you talk about this innovation gap and then also the technology gap or translation gap. Is that kind of, what you're sort of referring to here, or is it something else?
Well, I'd say that those two gaps are kind of what I propose in the book. The biotech is the solution for. So, again, the innovation gap, I would say that there's a lot of diseases for which we lack great treatment options. So, pancreatic cancer would be a great example. Most people still die from that disease, and we don't really have a great way to treat it. Another example would be glioblastoma. There's lots of cancers, or Alzheimer's. There's lots of diseases for which we lack adequate treatment options. And then on the other hand, there's this translation gap where there's a lot of promising scientific ideas that happen in the context of academic research, but those ideas don't often get translated to patients. So I called that in the book the translation gap. And I think the implication of both of those things together is just that biotech has the potential to bridge those two things and to be a solution for both of those problems, to bring medicines that are potential medicines that are maybe not getting translated to the patients that need them.
Thank you. Thanks for that. And then you also talk in the book about, mitigating business and scientific risk from the outset as well, which I think is an interesting, it is an interesting concept from a scientific standpoint. I don't disagree with you from a business standpoint, but I think from a scientific standpoint, I oftentimes feel like there's so much that we just don't know. And then I've sat in the room with scientists that, just last night, all of a sudden we found this out. And, oh, by the way, we've got to try and mitigate this thing, quickly if we're going to continue on. And it feels like there's so many surprises in terms of the science that kind of unveil themselves as you go along. And so are some of your thoughts in terms of mitigating those scientific, sort of risks, early on in the life cycle of a company?
Yeah, that's a great question. And I'm laughing because I think that's the reaction a lot of scientists, including myself, would maybe have hearing that you should mitigate scientific risk, because it's like, of course, but it's complicated. And I understand that. I'm not trying to say that that is 100% avoidable, because of course it's not. Science is unpredictable, and even the best laid plans are often unraveled by science unfolding in ways that we don't expect. With that said, though, something that I was actually really surprised to hear in multiple interviews with very accomplished scientists was this concept of avoiding what we call in the book biology risk. And here's what I mean by that. So I talked to Ben Cravat, who is a co-founder of Vividian, amongst many other companies that have been quite successful. And something he said is, Stephanie, my motto is to embrace technical risk and avoid biology risk. And what he meant by that is, well, he's classified there as being two types of scientific risk. The first is technical risk, which is kind of the concept, if we're thinking about drugging a particular target, is whether or not you can create a drug that effectively engages the target of interest. So that's technical risk. Can you drug it? Part two is biology risk, which is, okay, assuming you can drug this target or, bind the target, modulate the target, whatever's going to happen, does that actually result in the biological modulation that you're expecting? So a good example that I use in the book are the beta secretase drugs, where they were able to overcome technical risk, where Pfizer and Eli Lilly and many other companies created drugs that effectively bound beta secretase. The problem, of course, was that target engagement did not actually result in clinical significance in treating the disease. And so that was an example of failing to overcome biology risk.
Hmm.
And so what Ben was telling me is that he will pick targets that he intentionally knows are very difficult to modulate, but he knows that if you are able to modulate them, they will have a clinical significance. And so obviously that sounds very simple and straightforward up front, but he was saying that in this era of you know, abundant genomic information, there's not a good reason to take on a lot of biology risk because there's so many targets that we know have the biology impact, and so we don't have to take that sort of risk from the outset. However, of course, there's a role to taking on that sort of scientific risk. It's just a matter of it increases your company's probability of success to avoid that. And something I hear Jake say a lot in meetings is that he tries to go after targets with known biology. And so he's again avoiding the biology risk and embracing the technical risk. And that's where especially our technology is able to succeed because we are able to do broadly neutralizing antibodies, for example, that bind these kind of difficult epitopes that tend to have a lot of genetic variation.
Yeah, and it's one of the questions that I have as somebody that, so I don't have a degree in biology. I've lots of degrees, but they're not tied to biology. They're more to business and more to technology. And so one of the key questions I guess I keep coming back to is, it seems like we really need to get better at everything before phase 1 clinical trials and really sort of, kind of improve our ability to decision, before we get too far invested, I guess, in drugs. I mean, to hear, some of the statistics out of your book where like $1.4 billion is typically spent to bring a drug, to market up to the point of NDA. And then also only 4% succeed. And with that, it continually brings to mind sort of this baffling thing that, how could we get so far down the road and have spent so much money and time, and then only to find out that this isn't going to work. And it seems like being able to fail earlier, might actually be a better option. But that's again from somebody that is not not somebody that's a biologist. So
Absolutely. I think failing earlier is a huge way to mitigate that. In addition to what I just said, which is focusing on targets with a higher probability of success. There's also the, I guess, complementary position, which is allowing yourself to fail fast, which is something we also talk about in the book. And I'm going to quote Jake again, but he has this great quote that's something like, I only have a certain amount of time in my life, and I don't want to waste it going after ideas that aren't real. So I don't want to trick myself. I want to know if the idea isn't real right off the bat. And I think a
mm,
lot of times companies and people don't take that mindset because it's your baby, it's the thing you're building. You don't want it to fail. So it's hard to run that experiment that tells you that your program is worthless. It's hard to be able to run that experiment. But if you get through that experiment, and this is something I argue in the book, you can have a much higher confidence that your drug is going to succeed in the clinic. And thus save yourself a lot of headache and money down the road, if you can prove to yourself whether or not something is likely to work sooner. And I think people are oftentimes really scared to run those really, difficult experiments. And so I think that's one way to think about it. The other point I wanted to make is actually the big cliff where a lot of drugs fail is not the phase 1, it's often the phase 2, because phase 2 is the very first time you're looking at efficacy in people. So, sometimes a drug will get through phase 1 and then fail in phase 2 or fail in phase 3. And I think if more companies took the perspective of, "How can I prove to myself that this doesn't work?" a little bit sooner, I think we'd avoid a lot of that down the road. Of course, not all of it. A lot of times it's difficulty in translating between animal models and the clinic. For example, giving cancer to a mouse is very different than the actual native disease in a person. And so a lot of the translation difficulty does happen around that. But just being willing to think through, based on whatever your disease is, what are the best, most telling animal models that I can do, instead of what's most likely to show positive data for my investors. Which, again, easy for me to say from this position, but it's very hard and emotional when you're on the other side of it.
Yeah, and even before the investors are involved, the oftentimes the conversations that I'll have with very early stage companies is around this whole idea that, this is going to be the next, blockbuster drug. We're going to be the next unicorn company. There's so much early optimism, and that's where, I keep coming back with, look, I don't want to completely shoot down your company, but at the same time, just a little bit of skepticism might actually help you in the end here, just to make sure that, you kind of checked all the boxes. It sounds to me like Jake starts from the right place, that, look, let's not waste a lot of time on things that aren't going to work, and let's, really focus in on the things that will.
Absolutely, and Jake is a really good example of that. He's a incredibly good strategic thinker as well as scientist, which is why I love working with him.
Yeah. And one of my favorite things, honestly, about your book is that all of your interviews and all of your references and things like that. Oftentimes you'll pick up a book that's trying to talk about entrepreneurship in anything, and essentially it will talk about things as if they were real people interviews or whatever, but you can't really see it. And then your book, you can definitely see, all of the time and effort that you put into it as well, because it's all referenced right there in front of you in the book. So thank you for that.
Well, thank you. That's great feedback. I remember my editors, when they were reading it, were kind of teasing me at different points, because it would, my first couple drafts, it would read a little bit like you're saying, like they can't quite tell whether I'm talking to this person or not. And then I'd be like, so and so turned and looked at me, and they were like, "Oh, I didn't realize so and so was in the room with us. Like, that was jarring. You need to fix that." So I had a couple comments like that. So big shout out to my editors for helping me fix that.
Well, that's good. And then, I feel like you really portray in the book as well all the different people that biotechs have to serve. You mentioned, essentially that there are 5 different key stakeholders: patients, physicians, investors, pharma companies, and insurers. And, it's so easy to forget 1 or 2 of those, especially along the way. I know that oftentimes I've worked with companies where they totally forget how reimbursement happens at different points in time. And it's sort of a big recalibration whenever they have to come back to that way of thinking. Or, even if you're looking to be acquired, then, what does a pharma company think about, you in the market, as well as essentially you as a potential acquisition target in the future?
Absolutely. Yeah, I think that's an invaluable thing to think about, and to think about early.
Yeah. So there are 3 questions that I like to ask every guest. What inspires you?
Uh, Great question. Um, Honestly, a lot of times, and I make this argument in the book, but part of building backwards is thinking about the patients that you are working towards, to help. And I think sometimes in the midst of the day to day in a company, it's easy to lose sight of your actual end users and the people that you're actually benefiting. And that does give you some sort of urgency when you remember that. So I'd say that patients and their families are very inspiring to me. And it's inspiring to me when established companies take that patient-centered perspective. One of the interviews I did in my book was with someone named John Crowley, who literally has a patient advocate on his board who votes on behalf of potential patient end users and is themselves like either a patient themselves or has a child who's a patient. And just being able to factor that perspective in, I think, is so important.
Yeah, I know that I've been a part of companies before where they would occasionally even bring patients in so that you could kind of, get a little bit better sense of what this journey is like that patients go through in some cases, because understanding, the path that they have to walk is part of the mission.
Absolutely.
In a lot of cases why people are doing these things. And, whether it's cancer research or vaccines, similar sort of story, you're out there trying to save people. So, it's great to hear their perspective as well.
Absolutely.
What concerns you?
Well, right now it's the markets, because it's a difficult time to be raising capital in biotech. And I think the biotech markets have been bull markets for a very long time. So there's a lot of investors who started their funds in the midst of that and haven't necessarily had to deal with an economic downturn yet. So I'm concerned to see how this will all shake out and see how long it'll last.
Well, we were both talking about, the fact that you went to bio, as well just recently. And so a lot of the investors that I've talked to, both prior to as well as post bio, essentially are saying the same exact thing, which is, hey, look, if you have enough gas in the tank to make it through, kind of the economic downturn that we're in, good for you. You'll probably do fine. However, there are a lot of people who just, are right now trying to look for investments, and it's going to be a tough road, for a lot of them.
Right.
And there may be some companies that get selective investments and some won't. Right. So
Right.
it's really unfortunate. So.
Right. That's the thing about the economic downturn is it doesn't just weed out the bad companies, it also weeds out some good ones. So
yeah, that's for sure. And what excites you?
honestly, the future at Centivax, I think we have a really, really strong proof of concept data set. And I think, our vaccine has, obviously knock on wood, but a fairly high likelihood of success in the clinic. Fairly high is probably even conservative, but I'm very excited to just see how things play out and all the work that we get to do there. Oh, and I'm excited to talk to more people about my book and to kind of see more young people and more young scientists get into biotech. I think it's a very exciting industry, even if we are in the middle of a downturn. And I think that there will always be a need for biotech. So it's great to see more people getting into it and getting excited about it.
And there's a lot of information in this book that people need. And so one of the things I wanted to mention here at the end is that the title of the book is Building Backwards to Biotech: The Power of Entrepreneurship to Drive Cutting Edge Science to Market. And Stephanie, I'm assuming that people can pick it up everywhere. Is that right?
Yes, everywhere. Amazon, Barnes and Noble, all the kind of standard places.
Very good. Well, Stephanie, thank you so much for being a guest on the Life Science Success Podcast. I greatly appreciated our time together.
Thank you so much for having me. And if anyone wants to connect, I'm always open and available to connect with people. Feel free to just find me on LinkedIn or email me.
Thank you for listening to Life Science Success. For complete details about this podcast, including show notes, how to get in touch with guests, and more episodes, please visit www.lifesciencesuccess.com. If there's someone you'd like for us to invite to the show as a guest, please let me know by sending me a message at the podcast website. Please click subscribe on your favorite podcast app, share the podcast, or tell a friend about it. And last but not least, rate the podcast. Thank you again.